Podcast. It's Robert Hawke's podcast.
Hello, it's Robert Hawke, and I am a speaker, author, and comedian. I gotta tell you, the best part about being a speaker, other than the free coffee and, muffins first thing in the morning, is the fact that I get to hang out and have conversations with people who are truly at the top of their game. I get to travel around all different parts of the country and meet these people who are doing wonderfully innovative things and just get to hang out with them. I gotta tell you, and you may have noticed this as well, when you meet somebody who's honestly really good at what they do, they're usually very generous about what they know, especially if they're innovating, especially if they're doing something really interesting or really different. And as a patient, I'm a cancer survivor myself, it is very heartening to meet people, particularly in healthcare, who are ready to collaborate and ready to share what they have. Recently, I was lucky enough to do a keynote for the Pharmacy Association of Saskatchewan and had a wonderful time. And I got the chance to sit down and interview two pharmacists who were doing great stuff, Robyn Despins and Amy Lamb. And we just got to have a conversation, and I really wanted to share it with you. By the way, if you want to get in touch with me or you'd like me to come and speak at your event, please track me down, roberthawke.com. You can reach me there, and Hawke is spelled Hawke. Without further ado, let's have the conversation. Hello, everyone. My name is Robert Hawke, and I am completely and utterly thrilled here today to be at the Pharmacy Association of Saskatchewan conference here in beautiful Saskatchewan. We are actually we are at the Elk Ridge Resort. And I'm here today with two pharmacists, Amy Lamb and Robyn Despins. Both practice in Prince Albert. Welcome, pharmacists.
Thank you very much, Rob. We're glad to be here.
Yeah.
Thank you.
Thank you. This is absolutely a pleasure. I gotta say, and I am not a pharmacist. That is not my gig. But I've been here at the conference, and I've met so many amazing people, and folks are so generous. And I'm wondering if you could just tell me, you both have different takes on pharmacy, and you work in different areas of pharmacy. Would you mind just talking about that? Amy, let's start with you.
We're working in a similar environment for the traditional roles for a pharmacist, but in sort of the sense of innovation and optimizing care, I now practice with an extra specialty in working with hormone replacement, functional medicine, and addressing some of the root cause analysis in people's disease states, symptoms, and lack of well-being. And so it's a role that's expanded beyond just the use and optimization of just medication therapy into full-on comprehensive management of what are the best appropriate dietary measures, stress reduction techniques, vitamins and supplements that are best evidence to really help somebody get a good manage on their care.
Okay, that's awesome, and that sounds really smart. Can you?
Thank you.
It does. Can you dumb it down for a guy like me? Like you, I know officially you are. You have a specialization in is it hormone replacement. Is
hormone
that correct?
replacement therapy, which is definitely just one piece of the puzzle. And the way I kind of describe it to my patients is that, you've got all of these things that you're supposed to have in your body that are good, and then there's some things that you're encountering on a regular basis that are bad for your health. And so we try to replace the good, remove the bad, and allow your body to kind of reach that balance of health again. And it's been pretty transformative. And again, it's something that we look at that's a bit more personalized. Instead of saying that everybody with this disease state is indicated to have just one drug, this is saying that you, based off of your family history, your dietary intake,
right,
all of the things that have affected you in your life, and even some of the medication that you're taking may be causing either deficiencies or excesses in certain areas of your health, and working
right
to optimize that.
See, now, that takes me off into like a whole thing I want to discuss, but I also want to get Robyn involved in here too. What is your aspect of pharmacy that you're really focusing on these days?
Yeah, so I have kind of a bit of a different approach where I'm dealing more so with chronic disease management.
Right.
For people that might not have access to services, are struggling perhaps with other determinants of health.
Mm-hmm.
So kind of taking it away from optimizing. I'm actually kind of more so working in a vulnerable population.
Interesting.
So we work with, I work with a doctor, a couple doctors, some nurse practitioners, nurses in communities across Saskatchewan,
Right.
usually rural and First Nation communities.
Right.
And basically we take our team and we travel to them in order to
Wow.
get rid of that barrier of access to care, which is huge for rural places all over the place, especially in Saskatchewan. So we take
So
our
do
team.
you go, like, you take your team, so it might
Yeah.
be yourself and a nurse practitioner, like what is?
Myself and a nurse practitioner and a nurse, or myself and a specialist and a nurse, and we travel to communities. We do clinics there, see our patients that we need to see. So as an example, we go to a little town to do Hep C and HIV clinic. We do our day and we see all of our patients, and then we just follow up through some of the local nurses that are on the ground in that community, like how they work with our team and connect with us when
Yeah.
we're not in the community.
Right.
As well as just over, the phone and follow up and kind of from a distance from there on. But we just usually have our regular clinics moving, every month or so like that.
That is amazing. So you're a medical roadshow. You go out and you go on to
Yeah.
go to these smaller communities where people don't have access so much, have a
Yeah.
day, and then say, we're here. And do folks make appointments, or they just line up? Like, what's the deal?
Yeah, we have appointments. It's all appointment based. We're pretty flexible. We generally, there's a lot of things going on in these people's lives. Oftentimes they're struggling with lots of different instabilities, whether it's home instabilities or income and education, food security. So there's lots of really complex things in their lives that are sometimes influencing, whether they can show up to an appointment on time. So we're
Right.
pretty flexible with as far as just making sure that they can get in and see us.
We were talking last night, and I've been able to get like a little snapshot of this community, and it is really apparent to me that Saskatchewan there's some really innovative stuff going on in pharmacy here. Would you agree with that?
Absolutely.
Definitely.
Yeah, I'd say that we have one of the most progressive models of pharmacy and enhanced care. We recognize that this is sort of a small town province, and access to healthcare is not always easy. There's towns in this province that don't have doctors, and so the optimized use of a pharmacist on primary care teams and in prescribing has
Right.
been totally transformative to approaching some of the
Right.
deficits and the gaps of care around here.
And that's amazing. So the scope of pharmacy and the scope of the pharmacist's role has broadened in the last few years, for sure. Would you agree with that? For sure, or no? Yeah.
Absolutely. Yeah, it has expanded, and I think where we're at now is we've recognized that from the context of how the health system is functioning now, that there are some gaps where patients are falling through the cracks
Yeah.
or don't have access to services. And I think Robyn and I are starting to recognize that, as we expand sort of our little innovative ideas on care, that these could be, models of better care that could be sort of parts of that brick and mortar that really improve the ultimate outcomes of healthcare in Saskatchewan.
It's amazing to me because, okay, as a layman, you know what I mean, and I'm come to this from the standpoint of a cancer survivor and a patient. Like, I don't have any of this experience, and the vast majority, as you know, of patients and just the general public, we think of somebody who's just dispensing pills and just takes this thing from a doctor or nurse practitioner and then goes, oh, here's the thing, and there it is, and take it and go. And then maybe they do some education. But your role is much, much broader than that.
Yeah, like I would say that both Amy and I in this type of innovative practice are completely separate from dispensing or handing out pills.
Yeah.
We really hardly do that at all, or I hardly do that at all. I'm not associated with dispensing at all when I'm in these communities.
Oh, wow, okay. That's
They
really
have
interesting.
their regular pharmacy for that, really, and
Okay,
I'm
got
kind
it.
of providing more of that cognitive or clinical service, and that part of that functioning on part of that healthcare team that's seeing the patient and treating the patient.
Right, and it's this concept of team and equal members of a team working together on behalf of the patient, and that's one of the newer ideas, isn't it?
It is, and I think that that's something that is going to be a solution in the future and is starting to become a solution as far as how can we provide the best care for people overall. It
Right.
means each one of our little professions
Yeah.
really practicing to its full scope within its little area, and then all together we create a big complement of a healthcare team, which is ultimately providing the best care for the patient.
Right, and one of the things I find this really fascinating because you're literally both working as part of the same pharmacy team.
Yes, so we both practice out of the same pharmacy, doing some of those conventional dispensary roles. And what we're doing alongside of these things are these more appointment-based and personalized approaches.
Right.
And, I think where Robyn and I really align in our idea of the future of the role of the pharmacist is recognizing that, the evidence and the impact of some of the personalized factors. When she talks about home security and whether or not somebody is able to access to foods or services or transportation to their appointments.
Yeah.
And I'm looking at it from the context of, right down to a cellular level. Where are your deficits and where are your extras? We can eventually, by working together and by, promoting and evidencing what this has done for our communities, start to be able to amalgamate optimal care into even the lowest socioeconomic groups that are the most vulnerable and the most in need of this type of interventions.
The scope of care that the two of you represent kind of blows my mind. Do you know what I mean? Like it kind of blows my mind because you're doing stuff, and I know you work with specifically with women who are many times trying to be pregnant and can't.
Right.
Do you know what I mean? And that's a really serious thing, and you dive deep into that process with them, as you were saying, kind of at a cellular and molecular level, and that's the science in that kind of freaks me out. And then
she's a genius.
Yeah,
Actually,
you brought the G word out, but yeah, man, it's there. Yeah, there you go.
There it is. It's
Send
recorded.
that to your mom and dad. Send that to your mom and dad. Yeah, 100%. But and then as well, you're doing stuff where you are working in a much more holistic way than I think most people would assume pharmacists do, like looking at somebody's whole life. And I'm like, to me, as a patient, I'm like, hooray, because you were talking about supplements. We were talking about, but you weren't just talking about drugs, were you? There's a whole other aspect. Can you kind of fill that in for me, please?
Yeah, so I think as pharmacists, we're very traditionally trained to kind of look at medications, drug allergies,
Sure.
Weight, height, age,
Sure.
and then, their history of the presenting illness or whatever they're coming in to see us for. And that's all extremely valuable. That's ultimately when we're talking about providing pharmaceutical care or doing what we do as pharmacists, those things are essential. But my theory, I guess, is that behind all of that best practice and all the evidence that we have and the research that we have and the guidelines, and then on top of that, what we know about the patient as far as their medical history and medication, behind all of that is the patient.
Is the person.
The person.
Yes,
They're they're right in front of us, and they have a whole different set of values, beliefs, motivators, a different social environment, which includes different levels of income, education, literacy, social supports, food security, housing stability, all those things that we have to take into account, as well as different health behaviors and access to care, which are all ultimately coming in to play on determining the health of that patient. So I guess my theory is that there's layers that we need to kind of start to add on that are more patient specific. So those things like their social environment and their health behaviors and their access to care, those are so specific to that person. And so what it means is that two people could be on the exact same medication, have the exact same medical history, but those other factors might be different. And then we need to start to be kind of looking at those and really assessing how they play into the health and care for that patient.
And in Saskatchewan, we have such a huge Indigenous population, and even some of the historical consequences of institutionalized racism and what these people have experienced within the institution of colonization of Canada. Like, these are things that if that's a population that is in desperate need of optimal health care and access to health care, that's one more piece that we have to be considering.
And that is incredible that you can do that. I was struck this morning. There was an elder from the community who spoke, and I just thought she was fabulous. Mm-hmm. But I was like, oh, okay. There is inclusion here. I guess what I'm saying is I'm seeing so much evidence, and I see so much hope, because you're looking you're just not looking at us as a condition.
Yeah.
And I gotta say, as a cancer survivor, and somebody went through, and I felt like I was in a mill. You know what I did? I was in a mill. Now you're at step 1. We're moving you to step 2. Now we're going to make you wait. I have no idea how long. Now the big step 3, and on it goes, and literally spit out at the end. And I don't get the sense of that here at all.
No, and my motivations came from being a patient myself and working in a conventional, pharmacy practice, and recognizing that there were some missing deficits, some comprehensive, personalized factors that would have needed to be addressed for me to reach that better sense of care and to no longer feel so vulnerable and helpless and no longer just own that disease. When somebody gives you the name of your disease, you take that on really personally.
Yeah.
And you almost become sort of a slave to it. And
yes.
This was just so empowering. And I've had students and mentees kind of come to me and say, well, what makes you the kind of person that can have these interactions, and what sort of training and specialization do you have? And I've got a hormone replacement specialty because it is a complex area of interventional medicine. But I keep telling them, you're a pharmacist. You've been trained in ethics and physiology and pharmacology. You've signed a Hippocratic oath to do no harm. You really are perfectly situated to be this accessible point of optimal, personalized care. And I tell you, if you're as empathetic as Robyn and I are, there's no way that you aren't going to make just an absolutely transformative action in every patient's life.
Yeah, okay. That leads me perfectly to this question. What would you say if there are new members of the Pharmacy Association of Saskatchewan or new pharmacists? What would you say to them if you have some time? What do you want to say to them if they're listening?
Well, I guess I think two things. One would be to your patients, and it is to start to look at who your patient is. Don't be afraid of asking more questions that might not mean anything as far as their pharmaceutical care. Like, ask about what they do for work or how many grandkids they have, whatever it is. Get to know the people that are in front of you, because that's going to create a deeper connection with them. Mm-hmm. Don't be so solutions based all the time. Sometimes just knowing more about them because they're people and we're people too, that can be incredibly powerful. And then don't be afraid to lean into some hard conversations that you have to have with your patients. So sometimes that means asking them if they have enough food, if they have enough money to make ends meet, or even just to pay for their prescriptions. So don't be afraid to lean into asking those questions, and then getting a sense of how they feel about the medication they're on, what their ideas are about it, how it's impacting their life, things like that. Just ask questions. Build trust with your patients, ask questions, and then ultimately let some of the answers that you find, those little tidbits that you find out about that patient, let it be something that adds into your whole kind of solution thought process as far as what we call kind of care planning and problem solving. So when I'm looking at you and you're my patient, I need to take all those little tidbits in addition to your medication and your medical history and all the things we're trained to do very well.
Sure.
And just add those in and let them impact that a little bit. Be flexible with and think critically on how you can really completely individualize what care you're providing to that patient.
You hit on something great that I really want to add to and cheer on for pharmacy students and folks who are already working. This concept of even just being with somebody for a minute who is having a hard time is very powerful, because I got to tell you, that's, as a patient, that is rare for us in healthcare. And even spending 30 seconds with us where we're telling you our side of the story, and you don't even have to find a solution for us. You don't. And I know that's ironic, because you are trained to find solutions. Like, that is what you do. So what do? You go in solution mode. You know what I mean? You find it, and sometimes it's enough.
There's healthcare practitioners and professionals that get very frustrated with the patient when they can't come up with the solution, when sometimes just showing that empathy is enough of a therapeutic intervention on its own.
Empathy is a therapeutic intervention. That's it. I want it on a T-shirt. It is. Absolutely. And it certainly was in my care and other people's care as well, for sure.
There are studies that have shown that empathetic practitioners who see patients with diabetes have better diabetic control just based on higher empathy scores from the doctor. Absolutely.
That's fabulous.
Yeah.
Well, I wish I knew that before I did my talk this morning. That's
yeah,
pretty cool.
No, I know.
You must have sat there and gone,
and I was like, here's the study.
Here's the study. Because I want to say things like, this has proven to be therapeutic, but I didn't know the research. It is.
Absolutely. And, to your question about, talking to
let's get your take on it.
Up-and-coming pharmacists, the the people entering the industry, and some people who are at the middle or tail end of their careers and are starting to feel really frustrated by the changes to our even economic viability. We're part of the publicly paid system in Canada, and of course we are subject to all of the changes and the challenges here. But ultimately, this is the best profession to enter in if you are innovative and if you are caring and if you are holistically focused, because this is the time for us to be able to take the most brilliant of minds and actually be able to apply optimal standards and really optimize the role of pharmacists. We're having graduates who are coming out and they're saying, I know what my capabilities are, I know what I have the potential to do, and the spot isn't there. Well, Robyn and I, despite me being a genius according to her, I'll just keep repeating that. No, but we're not special by any way, shape, or form. We saw something that we were passionate in, which really foundational was just patient care, and we just tried something. And anybody who's done new business ideas or entrepreneurship will tell you that you fail 100 times before something succeeds. But that doesn't mean that you shouldn't have that opportunity to give something a shot. And you're more than qualified. It just takes that first step. And I
we're
can tell
still
you,
working on it. I
totally.
mean, we're still just, it's kind of always a process. And I don't know what perfect practice looks like, but we're not there. Neither one of us. It's just kind of that grind that always, what you want to be doing. You just have to keep working at it to get there.
If there is no model for care of which you want to practice in, create it. And if you don't know how to create it, you work with your advocacy bodies and mentors and other leaders in the industry.
And you know what? I want to speak to that. Sorry.
No, are you kidding me? This is terrific.
I want to speak to that in the sense that, so we talked a lot about giving value. So, we're providing this care in whatever way to the patient. There's value to be had for each patient. There's also value to be had in healthcare provider teams and in your community, and then on advocacy boards and in your province as far as your whole professional body, and then on a bigger scale with like government and other stakeholders. So the point is to always, if you're trying to achieve a certain type of practice or trying to innovate and trying to change, we want to make sure that we're always finding ways to show that value in each one of those things. And those people are going to become our cheerleaders, and they're going to realize why pharmacists matter in the big picture of all of this, whether it's the patient and why we matter in their life, or a doctor that wants to pay us to do something for them, or government.
Both of you are innovators in pharmacy. And what I'm noticing in everything that you're talking about, there is a level of bravery in doing that. I don't know if you're aware of it, but I'm certainly aware of it when I'm talking to you. There's like this awareness of, one of you said, there's a gap here. There's a potential for better care here. And rather than waiting for somebody else to have a protocol or an idea or a solution, you saying yourself, let's do this. Let's go there. Let's do it. Let's put some resources in it.
And when you talk about that bravery, I don't consider myself all that personally brave. I consider my patients to be brave. And what they are dealing with and the fears that they have and the daily struggle that they have either with their own conditions or with, caregiving for loved ones, that to me is the bravery that I fight for. So it gives me the courage to push these boundaries. It gives me the initiative to be on boards that help with the advocating for the pharmacy profession. We're not trying to get more money. We're trying to get better care. We're trying to just, fill in those issues where people aren't being optimized or having their needs met within our system.
That's amazing. I got to say as well, in my brief time here with the Pharmacy Association in Saskatchewan, there is a very real sense of community amongst the members.
We're really lucky.
It's something. And I've just, I did my thing and I've been hanging out. Folks support each other. Can you talk to that for a minute?
Yeah, I think that I think it's kind of, we mentioned that it's like a small town province. It's kind of just, we are all connected, and I think everyone, no matter whether you're coming from an industry or you're coming from a franchise or an independent pharmacy or hospital or something weird like we're doing, something out of the box.
Nice.
Whatever it is, I think that you're kind of always looking and cheering on the other people that are championing whatever it is that they're doing really good. I think we're all fighting for the same cause, the same goal, which
Absolutely.
is what Amy said. It's optimal care, it's better care, it's filling gaps and creating the value of the pharmacist in the healthcare system overall.
We're really blessed with sort of the regulatory body. Those are the people who sort of lay down the law for pharmacists. And, they carry a perspective that sort of indicates that enhancing the role and the utilization and expanding perhaps the scope of pharmacy really ultimately results in better care. And so although these are risks, they're still at such a benefit, and we're just very blessed to have the perspectives and the partnerships that we have here in this province. Robyn and I, we both practice in our hometown. And 85% of graduates from the University of Saskatchewan as pharmacy graduates stay in the province, and many of them return home. And we're from Prince Albert. It's a community that is struggling with socioeconomic and health issues and inequity issues and complex trauma and you name it. But it's home.
Yeah.
Right, and the impact that you can make on your own communities is something that just is so resounding throughout the profession of pharmacy, especially in Saskatchewan.
That is really interesting. And you've got the desire to come back and help your own community and serve your own community. And one of the great things about that too is you have such a depth of knowledge about where you're from. You know what I mean? You've been living it and breathing it your entire lives. So, and somebody coming from somewhere else might not be able to have that perspective or that cultural sensitivity or whatever it is, which is fabulous.
I think really foundationally it comes down to the person behind the disease and the person behind the drug therapy, and recognizing that even that small step in understanding the importance of communication and empathy in your role as a science practitioner, either way is so much more important, and the science of being empathetic is there. And if anybody ever wants to have a whole bunch of resources on meditation and soft science and stress reduction techniques on very hard evidenced values like A1C and heart attack rate and depression rates, give me a shout.
Hey, that's awesome. That's awesome. And I got to say, from a patient perspective, hearing all of this is very heartening, and it is very hopeful, because from the patient perspective, sometimes it can feel like healthcare is absolutely foreign territory to us. And I'm sure you've encountered patients who feel that way. They're nervous, they're scared, they don't know what's going on. And on behalf of patients, I want to say thank you to you two, for the two of you, for the, not the band, but the two of you who are doing this work and who are really putting yourselves out there and stretching your talents for your community. And also, as well, I want to say thank you to the Pharmacy Association of Saskatchewan, all the members, for doing such wonderful hands-on grassroots level in your community. I'm sure your community knows it and appreciates it. This is Robert Hawke. I'm an author and a speaker. You can check me out at roberthawke.com. Hope you're having a wonderful day. Thanks a ton. I really appreciate it.
Thank you.
Thanks.
Podcast. It's Robert Hawke's podcast.